This session is different from the earlier lectures because it is designed as an Orishki IRB SCIS or X interactive case-based review. The goal is to take everything we have covered symptoms, red flags, procedures, medications, workflow, and patient teaching and practice using it in realistic situations. And this should sound less like a standard lecture and more like guided clinical reasoning at the MA level. For each case, we are going to ask the same 6 questions. What symptoms matter most? What follow-up questions should the MA ask? What are the red flags? What procedure or medication might be involved? What patient education is needed? What should be escalated? That repetition is intentional. It builds a practical habit. Let's walk through the cases one at a time. Start by noticing that this case is not just reflux. Chronic heartburn may sound common, but trouble swallowing changes the urgency. Follow-up questions might include, does food feel stuck? Is swallowing painful? Is it solids, liquids, or both? Has there been weight loss? Any vomiting or bleeding? The likely procedure discussion may involve an hygioi. Patient education may include basic reflex guidance and explaining what an upper endoscopy is. But the most important teaching point is that trouble swallowing with weight loss is a red flag and should be escalated. Here, the MA should ask about pain location, duration, stool frequency, amount of blood, fever, weakness, and whether the patient is able to keep up with fluids. This case raises concern for inflammatory conditions, infection, severe colitis, or other urgent problems. The red flags here include blood in stool, fever, severe pain, and possible dehydration. Escalation needs to happen quickly. This is a workflow case. The follow-up questions should focus on exactly what the patient has been told, what they have already done, when the procedure is scheduled, and what part is confusing. Did they misunderstand diet instructions, timing of the prep, clear liquids, transportation requirements? This is where teach back home becomes essential. Ask the patient to explain the plan back in their own words. This case may not be an emergency, but poor prep can cause a failed or delayed procedure. Here, the MA should ask about stool frequency, stool consistency, abdominal pain, vomiting, appetite, hydration, activity level, and the current medication list, including over-the-counter medicines. Many older adults have constipation related to medications or slower bowel movement. Patient education may include hydration, bowel regimen instructions, and when to report worsening symptoms. Escalation depends on red flags such as severe pain, vomiting, or inability to pass stool. This is a good reminder that a normal looking scope does not always mean nothing is wrong. Follow up questions should include stool frequency, duration, weight loss, nocturnal symptoms, medication use, and whether biopsies were taken. This could still fit conditions like Bayerhan microscopic colitis. The MA's job is not to diagnose that, but to avoid oversimplifying the case and to document details carefully. This case invites questions about symptoms such as fatigue, swelling, itching, jaundice, alcohol use if appropriate to workflow, medications, and follow-up plans. Patient education may involve explaining additional liver testing or imaging in simple terms. If the patient has your new jaundice or worsening symptoms, that raises urgency. As you work through these cases, notice the pattern. The MA role lives in the questions, the documentation, the teaching, and the escalation. You are often the first person helping organize the story. Better questions lead to better care. The reason this case session matters is that real clinic work rarely arrives in perfectly labeled categories. Symptoms, medication issues, procedure questions, and workflow problems often come together. Learning to pause and ask what matters most here and what should happen next is one of the best habits you can build.